Well, hi everyone, it's Bronnie here again for another day in Bronnie's world, and it's Tip Tuesday here in my part of the world. It's day 1062 in Bronnie's world. Now, I have a really gorgeous guest for you today. This man, I got introduced to him from another friend, and this other friend said, oh, he's a doctor of such and such. And I thought, I can't even pronounce that, what it is he does. So he intrigued me. So I asked our guest, whose name is Dr. Jim McCarty, no H, and he's actually a chiropractor, but he specializes in the head and a few other things. But anyway, so I just was so intrigued with what my friend had said that he does, that I knew I had to bring this guest to share with you all here in Bronnie's world. And I think he's a really nice bloke, because him and I are on a few Zooms together through the week, and when he can get on and I can get on at the same time. And so I just have actually kind of fallen in love with him in that respect as a friend. And he's always been really cute and kind to me, because I think it's because I'm Australian, I'm not sure. But anyway, I'm going to hand it over to, with no further ado, to Dr. Jim McCarty to share with us his story and what he has to offer for you today here in Bronnie's world. Take it away, Jim. Dr. Jim.
Thank you, Bronwyn. And I just want to say that your smile is something that makes me smile when we're on the Zoom calls together. And I appreciate it so much. I'm always looking forward to seeing if you're actually on the calls. So you're correct, I do have an interest in Australia. Years ago, I actually considered moving either to Sydney or to somewhere over there in that area, because I was interested. I looked at the possibilities of being able to go to New Zealand or Sydney and being able to move over there as a doctor. And I am a doctor. I graduated from chiropractic college back in 1984 and started my own clinic and began specializing in headaches. Now, the reason I got interested in headaches was because my mother had headaches all the time as I was growing up. And so I wanted to be able
My mum too.
So I wanted to be able to help people with headaches, to reduce head pain. So that's kind of how I got interested in the headaches. One more thing that I'll just share with you is that before we get into that, is that years ago I met a girl whose mother had moved to Australia, and she was also a chiropractor. And so that's what got me kind of interested in Australia. And she had gone over there and she ended up doing a bunch of work with the native people that were the Aborigines.
Yeah.
And so because she was doing work with the Aborigines, and she found that there was some issues that they were having with sniffing gas or glue, things like that. And so she helped them out with that. And they ended up inviting her to go on a walkabout with them.
Yeah, the good old walkabout.
And she thought that was going to be that they were going to invite her on a picnic, and then they were going to honor her with some trophy. And it ended up not being what she thought at all. And she ended up writing the book, Something Down Under. Okay. It was a book, a best-selling book that she wrote. And I'm trying to remember the name of it, but it talked about her walkabout and how what she thought was going to last one afternoon that ended up lasting about 3 months.
I was going to say. when they go walkabout, you don't see them for a very long time.
Right. So it was a very interesting book, and so an interesting family. So that was kind of my understanding of getting a little bit deeper into what's going on over in Australia. So back to when I was little, I grew up in it was actually my stepmother, and she had these migraine headaches. And as she had these headaches, then she would have pain, head pain. And so Dad always taught us, boys, be quiet. Your mother has a headache. Boys, don't slam the door. Your mother has a headache. Okay. So she got pregnant. They wanted to start a family, and she had a miscarriage. And then she got pregnant again and had a second miscarriage, and then a third one, and then a fourth one. So needless to say, her hormones were up and down, up and down. Now, I was just a little boy, so I didn't have a clue about this because I wasn't a doctor yet. But I stored it away in my mind, and I wanted to be able to help people with head pain. So as I went through chiropractic college, they taught us that the problem with the headaches is in the neck, specifically the brain stem. So I studied that real good. And when I got out of school, that's what I specialized in, was working on the neck to help take pressure off the brain stem. And then I also used my hands to work on the bones of the skull. Where the bones of the skull come together are called sutures. So I worked with my hands on those sutures on the skull to get the motion back into them that all osteopaths in the world are taught, that those skull bones move your entire life. The medical doctors are taught that those skull bones fuse, but the osteopaths are taught that those skull bones move ever so slightly your entire life. And the osteopaths are right. So I worked with my hands, working on their skull. I worked on their neck using my hands, and I had really good success. And then that was back in, I graduated in 84. So that was in 85 and all the way through to the 90s. And then in 1996, in the spring, I had a patient come to me with a headache. And before she left one day, she said, have you ever heard of this advanced cranial work? Now, we had talked about the cranial work. There's craniosacral, working with the head and the tailbone, the sacrum area. But this is advanced cranial work. It's not regular craniosacral. So she asked me if I knew anything about it. And I said, yes, I know. I've heard of it. She said, are you trained in it? And I said, no, they didn't teach that at my school. They didn't have anybody that was trained in it. And so she said, well, I've got an article. And my husband and I subscribed to this newsletter. It was called the Last Chance Health newsletter. And she said, we've read several articles about this particular technique. If I left you a copy, would you read it? I said, of course. So she ran out to the car, got it, brought it back in. And after she left, I started reading. And to be honest with you, Bronwyn, I read it and it sounded too good to be true.
Yeah. How often do we think that?
I read through it and I saw the list of the things that it said that it would help. And I thought, man alive, this sounds like a used car salesman wrote this article. Nothing could be that good. So anyway, I read it and then I tossed it aside. Again, just thinking, it sounds too good to be true. And about a month later, she came back in and she asked me, did you read the article? And I said, yeah, I read it. And she said, it's great, isn't it? And I told her, nope, it's not. It's a bunch of baloney. And her face dropped and she said, "Why are you against it?" I said, "I'm not against it. I just think that they exaggerated in the article." So she told me, she said, let me just share something with you. She said, "My husband and I subscribed to the newsletter. We read 2 or 3 articles, and after we read it, we thought this would help me with my migraine and it might help him with his shoulder problem." So they called up the doctor that the article was about, and they said, "We would like to get an appointment." And he told her we would be glad, or he said, "I'd be glad to see you in a year." And I did what you did. I stepped back and I went, "A year? Who wants to wait a year to be seen by the doctor?"
Mm.
And she said, "That's what we told him." We said, "We don't want to wait a year." And he said, "Well, I'm booked up for the next year." And so that made me start think. I said to myself, if he's booked up for a year, that means he's seeing a lot of people and he's bound to be helping them. And so we started talking, and I told her, I said, "Now that you've given me that extra information, I'm going to reread that article. I've got it right here on my desk. I'm going to reread it tonight." And so I took it home and I reread the article, and I took a piece of paper and I drew a line down the middle of the paper. And on the left side, I put everything that I believed, that I understood how that advanced cranial work could do what they were claiming. I could understand how it could help a sinus problem, which was in the head. I could understand how it could help a migraine headache. I couldn't understand how it could help something in the knee or the foot. That didn't make any sense to me.
At the
But
time.
so I reread the article, and the next day, probably 2/3 of the things in the article, I said to myself, "Okay, that's believable. That's believable." And about 1/3 of them I still didn't believe. So I called the doctor the next day and I said to him, "Does this really work?" And he didn't hesitate. He said, "Yes, it works very well." And so I asked him, "When are you going to teach it?" He said, "In the fall." And I said, "Well, I'll be there." So that's how I began to learn the advanced cranial work. I learned my regular chiropractic doing the work with my hands on the neck and the brainstem. And then I did the other work with my hands on the head. And then I combined that with what I learned from this doctor, which uses a small instrument with a little balloon on the end of it. And it's actually placed into the nose.
Oh,
And
wow.
then, yeah, and then air is put into it. We actually hold the nose and put a little air in there, and you feel some pressure the patient feels pressure in the nose, and then they feel it. They feel the pressure, and then they feel the air in the little balloon go bloop to the back of their throat. That whole thing takes about 3 seconds. Now I'm spending about half an hour working on people doing the preliminary work, but the balloon itself lasts about 2 to 3 seconds. Everybody says it feels like they jumped in the swimming pool and got water up their nose, and they felt pressure.
Yeah.
And about half of the people tell me that they can actually feel and hear the bones in the nose, the cartilage. They can feel it and hear it moving. So that can be a little bit scary for 2 seconds.
Yeah.
And then they're like, "Oh, wait a minute. That was strange. Never had anything like that. Never had an adjustment like that. Well, wait, I can breathe better." They can breathe better through their nose. And so they're getting more oxygen to their brain. the
Which is a
brain,
good thing.
that's a very good thing, because as we get older, then what happens is the brain doesn't get as much oxygen, and it actually starts to dry out as we get older. It's a natural thing that happens. Our skin dries out, our brain dries out, everything loses about 1% every 2 years. The brain gets a little drier.
Wow, I didn't know that.
Yep. And so when we're born, our skin's really soft and smooth. Our muscles, they're about 70% water. Our kidneys are about 90% water. The brain starts out at 90%, and as we get older, it gets a little drier. And when we get to about 40 years old, then we've lost about 20% of the hydration of the brain. So we're down from 90% to 70. That's where people start to have forgetfulness. That's where they start to get the brain fog. So people who interview me, they ask me, well, who needs this cranial work, this advanced cranial work? I'm like, anybody that wants to get more oxygen to their brain, anybody that wants their brain to be working better and be on top of their game, because they don't want brain fog. Yep. Anybody that wants to avoid dementia or Alzheimer's.
Sounds like I need that.
We could all benefit from that. But specifically, what I'm focused on is working on occipital neuralgia. Now,
Okay, say that real fast.
the occiput is the back of the head. You have the frontal bone in the front and the occiput's in the back. Your temporal bones are on the left and right, and on the top is the parietal. So the occipital bone's in the back of your skull. So they call it occipital neuralgia. So neuro means the nerves, and algia means pain. Okay, so pain in the nerves in the back of the head. Okay, so the interesting thing is the medical doctors do not have a good solution for occipital neuralgia. The prescription drugs that they use don't work very well.
No, they don't.
No. And so the people, they go through and they'll try everything from nerve blocks to nerve ablations to Botox to gabapentin to Neurontin and OxyContin.
None of those sound any good.
No, all of those clog up the liver. They affect the liver. And these people end up on 8 or 10 of them, the OxyContin per day.
I haven't heard anything good about that one.
One every hour.
It's crazy.
So by the time they get to me, do you think that I'm the first doctor that they call up? Heavens no. By the time they get to me, they've already been to 12 or 24 doctors. Their primary care doctor, the neurologist. They've been everywhere. I don't know the names of the clinics over there in Australia, but over here we have the Mayo Clinic. And a lot of these patients have already been to the Mayo Clinic. And they're told, we don't know what's wrong with you. It's all in your head. You must be depressed. Maybe you are depressed and you just want attention. And the patients tell them, look, I don't want the drugs. They say, see, you're a non-compliant patient. You don't want to take our prescription drugs. And so they get sent to the chronic pain clinic, which is run by a psychiatrist. And so then they get labeled as chronic depression.
Mhm.
And that goes onto their file. So by the time they find me, and how do they find me? Most of them go onto the internet and they'll go on Google and they'll type in their symptoms and they hit enter. And Google will come back and tell them what you've got is occipital neuralgia. So then they start researching occipital neuralgia. And they end up with some websites that pop up and some YouTube channels that will pop up where doctors are talking about everybody from the Mayo Clinic to anybody that treats that particular condition. So the ones that are meant to, they end up seeing this YouTube channel, and here's a doctor that's talking about what causes occipital neuralgia and how to treat it. And most of these people have gotten onto a support group, like a Facebook support group.
Yeah.
And I can tell you that everybody in the support group is so negative, it's pathetic.
Mhm.
All that they're doing is they're gossiping and groaning and complaining and saying, I've tried everything. I've been to 36 doctors. This is driving me crazy. Life is not worth living anymore. I can't take it anymore. What's the answer? Why can't my doctor find the problem? So they end up complaining and complaining. And then maybe 1 out of 1,000 people might say, hey, wait a minute. I saw this doctor on YouTube. Anybody know about him? And then one person will respond and say, that's a bunch of, well, actually, a lot of people will respond and say, that's a bunch of garbage. Skull bones don't move. And then one person will respond and say, I was skeptical, but my daughter got hit in the head with a bucket and she couldn't even go to school. And she's only 15 at the time. And she couldn't even go to school anymore because she couldn't focus anymore. Anyway, this mother had already taken her daughter to Mayo Clinic. They had put her on 6 different medications, and she was like a zombie. And the mother's like, my daughter's only like 15 or 17, and her life is over. Why did I have children? How come the doctors can't find out what's wrong? And she found me, and she called me, and she asked me, do you have a few minutes? Can I tell you about my daughter? And I told her, I said, after I heard the story, I said, I can help her. Come on down. And so she said, when's your first available appointment? And they came from Chicago down to Dallas, which is where I'm located. So when they came in, we went over the case history again. And the daughter was telling me, oh, I used to be a dancer. I could jump and run. I was very flexible. And now she said I couldn't even do the bunny hop in the Easter parade.
Hello, darling.
We have somebody here.
My 5-year-old grandson.
All right.
He's down for his birthday and they just got home.
That's great. I'm glad to see him. So I did my evaluation of Malia, and I started working on her, and she was an excellent patient. Excellent, excellent. And by the 3rd day, the mother came back in with her. I was treating her for 4 days, twice a day, once in the morning and once in the afternoon, because they were from out of town. So let me get just a sip of water.
I'll do the same.
So that morning when they came in, they were my first patients. And Judy, the mother, said, I've got something to share with you, something exciting. And I said, oh, okay. So we're starting off the morning with something exciting. I said, what's up? And she said, well, last night, after the second day of treatment, she said, we went out to eat and we ate dinner and we were coming home. And she said, Malia turned to her and said, Mom, I feel different. I feel like I could jump. And her mother said, what do you mean? You haven't even barely been able to move. And she said, I know, but something's changed. I feel like I can run and I can jump without pain. And her mother said, really? Are you sure? And Malia said, yeah. And so she took off running down the hallway at the hotel, jumped in the air, and landed and didn't have any pain.
How
And so
wonderful.
yes, and so I told the mother, I said, oh, that is so great. It would have been wonderful, super wonderful, if we could have somehow gotten a video of that. And the mother said, look right here. I've got it here on my phone. And I was like, oh my gosh. And she showed me the video, and Malia's running down the hallway, jumping like a ballerina, landed, didn't have any pain. She was smiling, and she told me that her pain had dropped from 8 to a 10 out of 10 down to a 4 out of 10. So it had dropped in half in 2 days.
That's wonderful. Oh,
And
oh
so we finished,
how lovely for that little girl. I mean,
yeah,
have a
yeah,
life
and
back.
so yeah, and so we finished working that week. And that particular weekend, on Saturday, I got a text message from her mother. And the mother says, hi, Dr. McCarty, it's Judy. You have just made me the happiest mother in the world. And I'm like, well, hey, that's good for a Saturday morning. And I'm like, well, what's up? And she said, well, Malia said that she woke up early this morning and the headache had gone from a 4 back up to a 6. Well, that would seem to be going like a yo-yo in the opposite direction.
Yeah.
So she went back to sleep. And about 2 hours later, she woke up and the pain was at less than a 1.
Wow. That's good.
Yes. And so what I did was I got the movement back into the skull bones so that the spinal fluid could flow. And then
Yeah,
the
it makes sense.
spinal fluid hydrates the brain, and it acts like hydraulic fluid to push the bones to hold them into the correct place so that the pressure was not building up in her head anymore.
Wow. That's a great story.
Yeah. And so Malia is now 18 and a half. And of course, she got back into school, back into dancing. She's now been accepted at one of the universities in Florida. I think it's University of Florida, but it could be Florida State, one of those two. And she's now a cheerleader on the cheerleading squad down there in Florida.
Oh, how lovely. Wow. And she would have thought her life was over.
Yep.
That is awesome. That sounds like, really rewarding work.
Well, it is. And the interesting thing is that there's nobody else doing the work that I'm doing. It's one more sip. There actually is a doctor, I believe he's in New South Wales, that has been trained, not by me, but by somebody else that does work that is similar to what I do.
Okay.
He's been trained in the last couple of years, and I've been doing it since 1996. So there's a difference in the level of experience. There's also a big difference because of the research that I've done through the years, and the research, the research makes all the difference in the world. It's taken it to a whole nother level. So I have not met the doctor in New South Wales. He doesn't know me, I don't know him, but I do know his teacher. And so I know basically what he's been taught, but I know that he's also not doing the work that I've been doing since August of 2004. And that's made all the difference in the world also. So the interesting thing that happened is after I learned this advanced cranial work, I came back and started working on my patients. One of my patients came to me with the migraines, and she said, Dr. McCarty, I called your office last week and I got the answering machine. Did you go to that seminar, that class that you told me you were going to go to? And I said, yes, Carol. And she said, well, how did it go? And I said, it went really good. And she said, did you complete your course? I said, yes, I did. She goes, did you pass? I said, yes. And she goes, did you get your equipment? And I said, yes. And she goes, when can we start? Because she wanted to get rid of her migraine headaches. They were so bad that she would have to take off from work. This would be for like 20 years. She had to take off from work when the migraines would happen, lock herself in the bedroom with the curtains pulled down, put ice on her head. Her daughter would have to take off from work, and she just had to suffer through the pain. So she said, I want to be your first patient, and I want to get rid of my migraines. So we started that day. And sure enough, we got rid of her migraines. We worked on her for 4 days, and then we waited a month or two, and then we worked on her for 4 more days, and then eventually we worked on her for 4 more days. And I also did some allergy work on Carol, and we completely got rid of her headaches. And I talked to her. I moved to Denver, Colorado for 10 years, and then I moved back, and I called her up and I said hello, and we talked, and she said, I just want you to know, ever since you worked on me from 96 until 2000, the beginning of 2000, and she said, I haven't had any more headaches at all, haven't missed any work, and it's all because of the advanced cranial work you did and the allergy work you did.
That's wonderful. Yeah. Look, I know this sounds silly, but I've another naturopathic doctor that we both know was saying she worked with not a chiropractor, but a acupuncture or something, who knew they could actually help people so that they didn't, sort of constantly keep having the same issues. And she had said something to him, and that she wanted to say something to these patients about, better ways and things. And he said, oh, thank you for not saying anything. He was more interested in getting their repeat comeback instead of healing them. And she said, well, then I'm not going to go down that path, and went another direction with her naturopathic work. That was part of during her training or something, or near the end of it. And I can see so many people saying this, they're saying, oh, yes, they can see what you're doing would be absolutely amazing. But how many chiropractors would turn that around and not do what they should? So they had ongoing work. I mean, if you were helping people, you would have ongoing work because they would refer people.
Right.
Because I just don't believe in not treating someone properly, so that they keep coming back. That's sort of not ethical, is it?
Well, the work that I do is outside the medical box.
Yep.
Because the people themselves have been trained to think that the skull bones quit moving when you get to be about 18 or 20 years old. That's what they believe. And so because of that, if they've never gone to a osteopathic doctor, then they've never even heard that skull bones move when you're an adult.
Yeah.
And so
when you think about it, you can actually kind of, sometimes you feel it, you feel like your head's, exploding and moving, and you can, you kind of can feel it when you're conscious, when you think that's what that is. It's
pressure, it's head pressure.
Mm.
And so some people, that pressure gets locked up in maybe their left temple.
Yeah.
And if it gets locked up there, then they can have pain there. And then, they get prescribed some kind of medication from the pharmaceutical industry, and maybe it helps. Maybe an aspirin or an Advil or a Tylenol helps. Maybe prescription meds help.
Mm.
But what I'm finding is that it's a mechanical problem with a mechanical solution.
Yeah. And who doesn't want to have that natural way of helping, as opposed to just being full of drugs that the side effects alone boggle my mind, actually.
So I actually was focused on people with headaches. So the first lady that knew I was going to take that training was the first person that say, hey, can you work on me? I want to get rid of my migraines. The second one was completely different. She heard me talking to Carol, and she said, well, I called you last week too, and I got your answering machine. And she said, what else does this do? And I said, well, it moves the bones of the head incrementally, just a little bit, so that the fluids can flow better. And she said, I heard you say something that this will get more oxygen to the brain. And I said, yes. And Barbara told me, well, I never told you my complete story. Said,
now the truth's coming out.
Yes. And she said, when I was born, she said that under the breastbone, the thymus gland, and the thymus gland was enlarged. Mm-hmm. So the medical doctors told her parents that what they needed to do was give her a very small dose of radiation to kill out part of the thymus gland under the breastbone. Well, you can guess what happened. They gave her too big of a dose, and they completely irradiated her whole thymus gland and destroyed it. Oh. It does not exist anymore. Just some scar tissue. And so the thymus gland is responsible for your immune system. It makes the cells that have the memory for your immune system.
They should have left it alone.
So they should have. However, this lady was a little bit older than me, and so this happened when she was an infant. Mm. So she didn't have any say-so in it. But she told me every time she would be in school and some other child would get a cold, she would get it too, because she had no immune system. And what Barbara's thinking was, but Dr. McCarty, if this will get more oxygen to the brain, maybe that would help my immune system. And I had to think about it, and I go, oh, you got me there. I think you're right. It might help. So she told me
Worth a shot.
Yeah. So she told me she wanted to do it. So we did the work on her also. Okay. And pretty soon the word began to spread that immune systems were better, migraines were gone, miracles were starting to happen. Okay. Another guy came to me, and he was from Sweden, but he lived in the States. And he was sent to me by his secretary. And he came in limping to work one day. Now, he always limped. He was 6'3", but he had polio when he was 1 year old, and it affected one of his legs. So he was really tall, but he walked with a limp. And so one day he walked into work, and his secretary saw him, and she said, Mr. Bink, you're limping worse than normal. And he told her, says, I've got a herniated disc. I'm going to have surgery. It hurts so bad, and the pain's going down that left leg. And so she said, well, you need to see my doctor. And he goes, well, I've already seen 2 doctors. I already saw my primary care physician, and I already saw the there was a surgeon, an osteopathic surgeon. They both did MRIs. They both told him that he needed surgery for a herniated disc. So he already had it scheduled. He said, I don't need a third opinion. And the secretary kept saying, if my doctor tells you that you need surgery, then I'll believe it. So finally he said, you really believe in this, doctor, don't you? And she goes, he'll tell you if he can help you or not. He said, make me an appointment. So she made an appointment. He showed up. I did my evaluation, and I told him there's 3 different types of disc problems. 2 of them would respond to what I do, and 1 of them would require surgery. So he asked me, he says, do you need to do another MRI? I said, no, don't need to do all that. So we talked about it. I did my exam. I started working on him. I told him, I said, if I worked on you for 21 days, and if you respond at all, you'll continue to respond, and you will not need the surgery. If you don't respond in 21 days, then you're got the type that needs surgery. So at the end of the first day, he said, can we start today? We started. And now at that point, I did not even tell him about this advanced cranial work. I just did some advanced disc work that I knew. So I worked on his disc. I worked on his sacroiliac. I worked on the psoas muscle. And in less than an hour, he got off the table. I said, now I want you to stand in front of me, and I'm going to put my hands on your hips, and I want you to march in place for me. And we had done that as part of his original exam. And I could see a difference in what was happening with his hips. But I didn't tell him yet. I just said, I can see a difference, but what can you feel? Can you feel anything? And he said, my balance is better. My leg doesn't hurt as much. Wait a minute. You said if I respond at all, then you know that I'm in one of those first 2 groups and that I don't need the surgery. And I said, yes, you were paying attention. And he said, then you already know that I don't need the surgery. And I said, you got it. So we worked for 21 days. He got 85% better. And at that point, he came to me and he said, look, I'm 85% better, but there's 15% to go. If I continue to work with you and you work with me, do you think we can make more improvement? And so that's when I told him about the advanced balloon work, the advanced cranial work, using the little balloon up the nose. And he said, wait a minute, this sounds really bizarre. This sounds strange. He says, it's my ankle, my left leg, and my low back that hurts. And you want to work on my nose? That doesn't make any sense. And,
Oh, dear.
and so I explained to him, I said, that's where the fluid comes from up in your brain. That's where the fluid comes from that goes down to the disc in the lower back. The ones that need to hydrate like a sponge.
Yeah.
He thought about it for a minute and he says, you know what? That kind of makes sense in an odd way. And he said, when I first came to you, I was skeptical. But he says, everything that you've told me has come to pass. You haven't lied to me at all. So even though it sounds weird that you want to work on my head when my pain's in my lower back, he says, I'm going to take a chance and I want you to work on my nose. I want you to get that fluid moving. I said, okay. So he said, can we do it after the beginning of the year? So we did. He came in, he was an excellent patient. I did the advanced cranial work using the balloon to move the bones of the skull. And at the end of the week, he was feeling even that 15% had gotten less and less. 2 months later, he walks into my office, unannounced, has the duck because he's 6'3" and he's coming through the door. And the very first thing he tells me is he says, hey, Doc, you were right. And I said, right about what, Mr. Bink? And he said, well, I don't have any more pain at all in my lower back. I don't have any sciatica going down my left leg. The pain in my ankle is gone. My ankle is stronger. I'm back to walking. I'm back to golfing. I can run for the first time. I think I said he had polio at age 1. It was age 10. He said, I haven't been able to run since age 10 because he would lose his balance and fall over. He said, but my ankle doesn't hurt. My balance is better. My sciatica's gone. My low back pain is gone. And my balance is so good that I'm back to walking. I'm back to golfing. I'm able to run without falling over. And my balance is so good that next week I'm taking up rollerblading. And I was like, you're kidding me, right? And he said, no, I'm telling you the truth. And I said, wear pads, wear pads. He said, I will. So last time I talked to Mr. Bink was in 2009 when I moved back to Texas from Denver. And I called him up. He told me, he said, hey, I moved to New Jersey. And I just want you to know, this is 2009. I worked on him back in 96.
Wow.
We were talking at that point, that was like, what, 15 years after the fact. And he told me, he says, I just want you to know that I still don't have any lower back pain, no leg pain, no ankle pain. I'm still golfing. I'm still rollerblading. I never had to have any surgery. So if you want to use my story, if anybody wants to know, does it last? Feel free to share my story. And I said, great. So that's what happened. I was mostly focused on headaches. And one day, a lady came in who I had been working with headaches. And so I worked with her. She was from out of town. Over half of my patients are from out of state or out of the country. And
Yeah.
she came in and she had a big smile on her face. She's holding out her arms. She says, can I give you a hug? And I'm like, why do you want to give me a hug? And she goes, can I just give you a hug? And I'm like, okay, what's going on? And she said, you fixed my TMJ, which is a jaw problem, temporomandibular jaw disorder. And I told her, I said, you didn't tell me you had TMJ. You told me you had headaches, migraines. And she said, that's true. But whatever you did to help my migraines also healed my TMJ. And so I'm talking to her out loud and I'm going, well, what did I do? Oh, I moved your temporal bone, temporomandibular joint. And she goes, you got to tell people that you can help TMJ. And I said, I don't know anybody with TMJ. And she goes, well, I do. And I said, well, you tell them. So at that point, most of what I was seeing was people with sinus problems, migraines, and then I started to see people with TMJ problems. Now, every now and then, you get the weird symptoms, and somebody came in. I had two people that first year that came in to see me that were opera singers. One was from New York and one was from Chicago. And so they both came in to see me and they said, look, I'm an opera singer. I sing. I have sellout concerts. I'm very well known. But every now and then they said that they get a sinus infection and then they can't sing because they can't hit their notes. And they have to cancel their concert and refund all the money, which hits them in the pocketbook big time. And so, and so they said, we heard that you can help people with migraines and sinus infections. And I said, yes. And both of them, neither one of them knew each other. And they weren't there the same week. They were about a month apart. But they both told me, I'm afraid to get the treatment because if you stick a balloon up my nose and you move those bones, what if it shifts the sinuses? And the sinuses play a big role on being able to hit all my notes. What if it ruins my voice and I can't sing anymore? And I told him, I said, look, I'm here to fix the sinus issues, not create anything. And so what I'm doing is moving the temporal bone, and then those sinuses actually begin to shift a little bit so that they can drain.
Yeah.
It should get rid of your sinus problems, which is why you're here. And it should not create any other secondary effects. So both of them said, it's already costing me a lot of money whenever I get a sinus infection, and that happens maybe twice a year. Let's do it. So I started working on them. And at the end of the week, each one of them came to me, just like the lady that said, I want to give you a big hug, with a biggest smile on their face. And they said, do you know what you've done? And I said, well, we've done 3 days of working on the skull bones to move those temporal bones and to move those sinuses so that they can start to drain. And I told you they're going to drain, and you may have a day or two or even a whole week of them draining. But that'll stop. And they both told me, they said, as an opera singer, I have to practice 4 to 6 hours of singing per day, hitting all my notes. They said the first thing that happened is, just like you said, the sinuses started to drain, kind of a post-nasal drip.
Yeah.
And then they said that lasted about a day, and then it stopped. And they said after the sinuses cleared up, they were able to breathe deeper because they breathe through their diaphragm.
Yeah.
They were able to breathe deeper, hold their notes longer, and they were able to hit one note higher and one note lower. Their
Wow.
range increased.
Which is great for an opera singer in particular.
Yeah, and they both told me, they said, my voice coach is going to say, why did you hire somebody different than me to help you? And they're like, I didn't. I went to see a chiropractor to help me get rid of my sinus issues. And they drained, and I could breathe deeper and hit a note higher and lower. And it happened for both of them.
Maybe all opera singers should go to.
I really ought to focus on them and reach out to them and even create a website specifically designed for them.
Yeah, sounds like a plan. Well,
Yeah.
any singer, actually, it would help any singer. I mean, how many singers do we know just sing through their nose, and it's clear that they're not breathing properly?
Yeah.
Right.
So the main thing that I've been working on that I had the interest in was headaches. And then along came the TMJ. So before too long, 80% of the people coming to see me were TMJ patients. I had TMJ and migraine headaches with an occasional person with disc problems thrown in because we want to hydrate the brain, but we want to hydrate those discs. And then there's every now and then you get some weird things. I think you know Fred Van Loo, right?
I do.
And Fred, actually, we were going to do an interview this last week, and we decided we postponed it for a little bit. But Fred wanted to interview me because over the last 4 or 5 years, he's been in my office and watched me work on patient after patient from other states. And so he was telling me, I'd like to interview you on some of the miracles that have happened in your clinic. He said, where I actually saw the patients come in and I saw them leave. And he said, and I've got personal knowledge that they're better. And so I was thinking, and I said, yeah, we can do that. I said, I can think right now of 2 ladies and a man. And so one of them was Malia that I told you about.
Yeah.
Who was the dancer that got hit in the head with a bucket and then couldn't even do the bunny hop. And then within a week, she was back in school and out of pain. The next person was a gentleman named James, actually. And he's a twin, and he's like 6'4" tall. And he was in a plane crash, a hard landing, and he got hit on the head. And he got an immediate headache, and then he was having neurological issues, okay? Having trouble walking, having trouble thinking. He was walking like a spastic person, okay? Like somebody with cerebral palsy. He was walking like that, and he was in severe pain. Anyway, he came to see me, called me, and he told me, he said, he's a Christian, and he said, I was praying at my house, and then he says, afterwards, I got up and I went on the computer, and I turned on the computer and typed in all my symptoms, and up popped your website. He said, I decided to watch it. He said, it sounded a bit strange. Here's a doctor that wanted to put a balloon up my nose and inflate it. And he said, I'd never heard of anything like that. But he says, I called you and I talked to you and you kind of explained things. And he goes, his situation was so bad that if he picked up a briefcase and carried it from his car to the house, he would vomit.
Oh, wow.
And
That's
the medical people for workers' comp told him, oh, we've run all the MRIs. You're fine. You're just trying to drag this case out. And he told him, he says, I don't want the prescription drugs. I just want to get well. I want to get back to being me. And so they accused him of just wanting attention. Even his own twin brother said, what's the matter with you? Get over it. Be tough. And he told me, he said, I am tough. But he said, something's not right. Anyway, he came to see me, and because he had been in the airplane crash, I knew that it was going to go to court. So we videoed everything that I did to him. I said, because if I'm able to help you, nobody will believe it. They're going to just say, skull bones don't move. So we got out the video camera. We videoed every minute of what I did for him. Anyway, I worked on him. He got well. It took a while. He needed more than the average number of treatments. And it took maybe a year and a half for him, something like that. And he had ringing in the ears, that buzzing, that tinnitus. And it was so loud, he said it sounded like a motorcycle going down the road inside of his head, along with all the neurological symptoms. So as I worked on him, that got less and less. And then it got to where he said, oh, the left ear sounds normal, but the right ear still sounds like a lawnmower making noise, right? And eventually we got all of that to go away. His brain started working again. He applied for a job. He used to work for Boeing aircraft. And his job had to do with wiring the planes.
Was it why he was in the plane in the first place?
No, but he was wiring all the planes so that the wires didn't get hung up and then the plane not fly right. Okay. So anyway, he had lost his job during all of that year and a half. And he had to start taking other jobs to help out, to meet the bills at home. Anyway, one of his friends at work told him, hey, there's a job, but it's pretty competitive, but I think you ought to apply. So he applied, and out of 300 or 350 people, something like that, he got the job.
Well, that's good.
They thought he was the most qualified. And he doesn't even have a degree, but he had the experience. And so he actually got a job, and they sent him for 3 years to Japan to work over there. So he's actually in Japan now. And he's told me, he said, hey, Dr. Jim, come on over, visit me. You got a place to stay. He says, I'm going to be here for another year. If you want to see Japan, now's the time.
You might have to take him up on that.
Yeah, I may do it. I may do it. So all of this is, and then the third person that Fred wanted to interview me on had to do with a lady from New Jersey that came to me in a wheelchair, 54 years old, in a wheelchair, but she looked about 90. She couldn't even sleep laying down. She had to sleep in the wheelchair, otherwise she couldn't breathe.
That's not good.
No, not at all. And so she called me up and we talked, and I told her, what's your biggest dream, your goal? If you could dream really big, what would it be? And she said, I'd like to be able to run again. She said, I used to be a fast runner. And she said, I had a head injury when I was 10, and I fell out of a swing, and I was knocked unconscious for 13 or 17 minutes. And she said, ever since then, I haven't been able to run.
Wow.
So I said to her, well, that's a big dream. And her husband was on the line too. And so I told him, I said, have her come see me, and I'm going to return her with more passion. What? More passion? Did you say more passion? She's on the plane tomorrow. Anyway, so she got on the plane, or he took her to the airport. The pilot refused to let her on the plane.
Why?
Because she looked like she was ready to die.
Oh.
And the pilot said, is that lady on my flight? And the stewardess said, yep. And he says, she's grounded. She's not getting on my plane. I'm not going to get up there and have to make an emergency landing somewhere. That's how bad she looked.
Oh, man.
She had to stay at a hotel, the next day get on a different airlines, which allowed her to get on. She showed up in my clinic. I told the secretary, we got somebody showing up this morning, and that's going to be one of my new patients. So the secretary came back and said, hey, Dr. McCarty, your new patient's here. And I said, well, tell her I'll be out there in a moment. She goes, she looks really, really bad. We can't even understand what she's saying. We think we need to call 911. And so anyway.
Just triple O over here.
And so I told her, I said, don't call 911. I'll be there in a few minutes. So I went and got her. I turned on the camera. I brought her back. The other patients knew we were going to have somebody in a wheelchair. We had a big room. I work in a big room. And so we're all in the same room. And so she comes back. I couldn't lay her on the table because she couldn't breathe. So I had to work with her in the wheelchair. And after a little bit, maybe half hour, she asked me, can I get on the floor and move around a little bit? And I'm thinking, oh, brother, if I get her on the floor, I'm going to have to lift her up to put her back in the chair. Anyway, we got her on the floor, and I asked her, Christina, what are you feeling? And what I really meant is, where are you hurting? What are you feeling? But she took it literal. What am I feeling? And she says, I feel like running. And I went, what? And she goes, I feel like running. Can I run? And I'm like, the only way we would know would be if you tried. And she took off jogging around the inside of the clinic. And we got it all on film. We filmed it. She went around 3 laps. And everybody's going, holy smokes. You know, we got people getting up out of wheelchairs and running for the first time in 44 years.
Wow.
So Fred saw that. He met her. He met James. He met Judy and her daughter Malia. And so he wants to interview me about those types of miracles that happen as a regular basis at our clinic.
Wow, that is awesome. You sure you don't want to come to Australia?
I may have to come visit you.
Well, we have a spare bed.
Anyway, what questions do you have, Bronwyn? Any questions of me?
Well, I've kind of been asking you questions all along, haven't I, and responding, but a lot of those symptoms I actually resonated with because I had them for years. And I know that, I had to, like what you said, the doctors were saying to people, oh, it's just all in your head, saying, and they just want to put you on all these prescription drugs, which I refuse to do. And I did then come across well, because the company that I was with went into this, was acquired by this other company that you and I belonged to.
Right.
And even just with getting off all the bad foods and everything, and I didn't even know there was a kind of a really good food, bad food list, but just doing that and supplementing properly with proper stuff.
Yep.
I didn't know. I knew I was missing something, but I didn't know what I was missing. And even that has helped. And, and then I could probably do with a little bit of adjustment too. So you have to come to Australia so you can do that. But, do you find, because I know you're with the same organisation I am, do you find that also helps your clients as well, sort of making them understand that, okay, you need to get off those bad foods as well? Do you do that as part of what you do?
Yes. You and I are both with the Longevity Company. Hope it's okay if I say that.
Yeah, you can say that.
Good. So we're both with the Longevity Company with Dr. Wallach, Joel Wallach. Yep. And Dr. Wallach, of course, did his research on all the minerals and how important minerals are to our body. Mm-hmm. So he's written books, many books, probably over a dozen books, maybe 20 books, okay, that he's written that have to do with his research. And so I have most of his books, not all of them. I still got a few more to purchase. But
he's coming up with some new ones too,
Oh yeah. He's got one of his latest ones is It's All in Your Head, and it has to do with cranial osteoporosis.
I actually have that one here.
Yep, that's it.
And it makes sense with what you're saying. It's what he's saying as well, everything. When you're saying people, but I've got the pain in my back, how's you moving my head or doing that sinusing, how's that going to help? Well, it's very clear because you're moving. This is what I'm hearing from you. You're moving those skull bones have to move, otherwise, they wouldn't be able to extend back out to free up the spinal column for things to work and for that fluid to do what it's supposed to do.
Right. And so with the regular skull, it has a certain thickness, and you've got a page inside the cover that shows a normal skull and an osteoporotic skull.
That's it.
Yep. And the bottom picture, the skull, the cortex, the white part, is thicker. It's thicker than the one on the top, which is normal. Okay.
Yeah.
But the one on the top is more dense. And the one on the bottom is thicker, but it's not as dense. It's had to get thicker in order to maintain the strength.
Yeah. Okay.
That has to do with absorption of our 90, the minerals, the vitamins, and the collagen and the proteins. And so Dr. Wallach has what he calls 90 for life, but that's the minimum. Some of the things he has that have the Healthy Brain and Heart Pack, they've got like 217 minerals and vitamins and proteins. And that's what we really need in order to get the body back up to where it needs to be. Otherwise, the bottom picture where it was so thick, osteo means bones, and porosis means porous. So those are porous bones. So they have to get thicker in order to maintain any kind of strength. But that's not optimum. The picture on the top was optimum. It's more normal.
Wow. And I would then, from listening to you, think, gosh, all those people you've helped them adjust their body, and then adding the 90 for life,
Yep,
their body will work properly, and it'll stop them all going back where they shouldn't be, like this bottom one,
exactly.
which I have found, and even we talk with Dr. Wallach, and I interview him every week. I have a chat,
Yes.
and people don't understand that, you know, you can do all these adjustments and changes like what you do, but if you're not maximizing all that, it's going to go right back to that, the bottom
They
one.
don't, they do not see the connection between the skull and their brain, which
Yeah,
is your computer that runs your body.
yeah,
Your brain is your computer that runs everything.
yeah. That's why
There's
they say
nothing,
if you're brain dead, then you're virtually dead.
yeah. And so you take the pressure off the brain, and all of a sudden the computer starts to work faster.
Yeah, that makes perfect sense to me. That you know,
It's like doing a tune-up on your a defrag on your computer,
yes,
because what you're doing is you're strengthening those bones of the skull, just like the bones of the hip.
yeah,
When people get older and they're walking along and then they fall and they go, oh, they fell and broke their hip. No, what really happens is they were walking along and their hip broke and they fell.
yeah,
So what we're talking about is the same thing that happens to the bones of the hip, happened to the rib bones, happened to the head bones.
mm,
And so what we're talking about is it creates pressure on the brain. And then the cranial nerves, that's what that book talks about, the 12 pairs of cranial nerves. And there's one that's very, very important, the number 10 nerve, the cranial nerve number 10,
yeah,
the vagus nerve. All of them have names and numbers. You can learn it either way, by the
yeah,
name or the number. And cranial nerve number 10 goes, it splits. And one branch goes directly to your heart and controls your heart rate
all
and
right,
your heart rhythm, the pacemaker of your heart. The other branch goes to your stomach and your small and large intestines. So it controls your digestion. So that one nerve controls your heart and your digestion. So if somebody has a heart arrhythmia, an atrial fibrillation, if
mm-hmm.
somebody has indigestion, either with low or high hydrochloric acid, then what happens is they start getting sick and they burp and they don't digest their food properly and they pass gas either by burping or out the other end. And everything has to do with that cranial nerve number 10, the vagus nerve, which comes down the left side of your neck.
Mm,
So if it's got pressure on it, it's getting irritated all the time and it's
yeah,
not functioning properly. So it allows the heart to relax. It allows your stomach to relax. So when it's irritated and under pressure all the time, then the heart can't slow itself down and relax. It starts going too fast. The digestive system, the stomach, and the intestines go into a spasm, and you can't digest your food. It's like being in a car on the highway and you've got the accelerator to the pedal to the metal, but you got no brakes.
no, that's not a good thing. That's not a good thing.
That's a recipe for a car
Disaster.
accident.
Yeah,
But none of this is explained this way to the medical community.
Mm.
The only people who understand it are the doctors who work on the skull bones, the cranial doctors, what we would call a craniopath like myself. Because if I just tell somebody, they go, "Oh, what do you do?" And I go, "Well, I'm a chiropractor." That's all they hear.
Yeah.
They stop right there. They don't know anything really about what I do, but they think that they know because of maybe what their medical doctor has told them.
Yeah. So you really don't call yourself a chiropractor per se. You'd call yourself a what
Yeah, a craniopath. Okay.
cranio.
I actually have to call myself a chiropractor, to make the board happy. But at the same time, my specialty there is studying the skull bones. And if you had 100 doctors and you had one that was a neurologist, that would be 1%, 1 out of 100.
Yeah.
Okay. Well, we do not have 1 out of every 100 people, out of 1 out of every 100 doctors who learn anything at all about the skull. You might have 1 out of 10,000 doctors. So if you had 1 out of 100, that'd be 100. That'd be 1%. If you had 1 out of 1,000, that's going to be 1/10 of 1%. And if you had 1 out of 10,000 doctors that studied craniopathy, at all, the skull bones, I don't even know what that number is, but believe me, it's less than, 1/100th of 1%. And then you have, out of those, they're doing cranial sacral work. And so most of the people that come to me, they go, "Oh, I tried some cranial sacral." Well, this is not cranial sacral. It's the cranial work on the advanced level taken to another level based on all the research. So is there anybody else that's doing what I do? No, not at this point in time. There are some people who do something kind of, sort of similar. Okay. But here's the question, if somebody, let's say, had sleep apnea, they might be able to go to the doctor in New South Wales. He might be able to he could do the balloon work. Has he ever treated anybody with sleep apnea? I don't know. I have not talked directly to him. I would have to look up his name. I think I remember his name, but there's a special website I could go to, and if he has paid his fees to be part of the marketing for that website, then he would still be listed as somebody trained in what I got trained in years ago. But he wouldn't be trained in the advanced work that's been done since 2004, because my instructor didn't want to learn about it from me. He had an ego issue. So,
okay.
Ego
gets in the way of so many of us, doesn't it?
Yes. So what you're talking about with Dr. Wallach and with longevity and with the 90 for life, and people need to get on, they need to get their cells function turned back on. That's what Fred does with quantum mugs. Okay. I drink all my water out of the quantum mug.
Looks like you had the big one.
I've got big ones, medium ones, small ones. I even grow my plants, my organic plants, inside of my small mugs.
Wow, really?
Yeah.
Oh, wow.
I took some pictures of those just this last week and sent them to Fred, and Fred was amazed. He was like, "Oh my gosh, I can see the root system in there, and it's sprouting on the sweet potatoes, and everything either goes into a small, medium, or large mug." Okay. even whenever I'm gonna cook some eggs,
Yeah.
the eggs, I'll put the eggs inside of the small mugs, the cup sized ones, and leave them there for several minutes before I cook them. I want the frequency raised up so that everything in my body is in tip top
Condition. Sounds
Yep.
like a good plan. I hadn't even thought to do that. But I mean, I don't have any of the mugs yet because we don't have them in Australia. I have to get them sent over from Fred, actually.
Yeah.
I'm trying to get that without them getting broken on the way. That's always a trick, hey?
Yeah, you gotta really pack stuff.
It is, yeah. Well, look, I know that you're busy and everything, and I have really valued chatting with you and your time. And guys, if you have any questions you want to ask Jim, just let us know in the chat, like underneath in the comments, and we'll get back to you. One of us will, and I'll have, when this goes up, Jim, I'll get you to stick up in the comments your link so if people want to get hold of you. And because I had a little chat before, I think you help people over the internet as well. Am I right?
Yes, there are
I mean, it
things.
wouldn't be quite the same, but
Yeah, there are things that can be done to help people. Lots of things. And so the main thing is learning what's available.
yeah.
I had somebody recently, I was on a Zoom call, and there's a lady that was on the Zoom call, and she said she was getting ready to have some surgery. So knowing what I know, I thought to myself, I bet I could help her. Now she's here in the States. And so I reached out and I just told her, I said, if you would like to direct message me, or you could reach out to me at this particular phone number, and I'd be more than happy to take 15 minutes and talk to you. And she said, oh, that'd be great. So after the Zoom call was over, we got online and we called, and so I just started asking her questions, did a good case history, and I asked her what was going on, and she had pain and numbness going down her arm, and it hurt really bad, and she had already been to a number of doctors,
Yeah.
and they told her she needed surgery. She needed fusion in the spinal cord, and that's what they said she needed. And they said that they thought that would help her. Okay. So I asked some questions. I said, well, when did these symptoms start? And she said, oh, they started in August. I said, what changed? And she started telling me, well, I did change my chair at work. I don't know if that could have caused it. I said, what else changed? And she said, well, I started wearing Invisalign. Well, Invisalign is like braces for moving your teeth. You can move your teeth, and what will happen is you move the teeth, and then the skull bones shift. And so what it told me, I asked her, I said, when did you start with the Invisalign? Because every month they put her on a different mouthpiece in order to move the teeth into a different position. And she said, I started with that with July. And I said, and when did your arm start hurting? Oh, in August. Okay, there's the connection.
Mm.
So she wanted to know, do I need to stop with the Invisalign? And I said, no, you don't need to stop with the Invisalign, but you need to do the Invisalign at the same time that I'm working with your skull bones so that I can unlock them and get that movement back, and the spinal fluid will flow, the disc will hydrate, and your arm pain will go away. Well, I'm scheduled for that surgery, you know. Okay, that's up to, last I heard, she had her surgery. You know, I can't force people to,
No.
you know, so we'll see what happens. I already know how to solve the problem. I already know what the problem is, but the medical doctors and the neurosurgeon is going to tell her that I'm full of baloney, except they won't use those words. They will
Well,
tell,
you know, it just amazes me. Like, I can't see how fusing things, your bones together, can be a good thing. I can't see that being a
well,
good
what
thing.
they're trying to do is limit the motion in that area so that the nerve's not getting pinched. So they're
It's a
taking,
safer way. Surgery is not, doesn't sound safe to me.
yeah, but some people, again, something as simple as moving a bone in the head that's shaped like a butterfly with wings, okay? And it's easy to move if you know, if you're trained, if you know what you're doing.
Yeah.
In the wrong hands, then it wouldn't make any sense at all. It would be like complete, utter nonsense. But if I know how to move what you call the dent on the side of your head that you call your temple,
Yeah.
and in 6 months, I can move that the thickness of 2 pennies, 1 to 2 pennies. 1 American penny is a 16th of an inch. 2 American pennies would be an 1/8 of an inch. So if I can get movement into those temporal bones an 1/8 of an inch, that's enough to take that fluid and let it flow better. Hydrate the brain.
Yeah.
The brain fog goes away. Dementia diminishes. The disc hydrate. That takes the pressure off the nerves. Okay, but the people, if they're medically minded and they want surgery, you know, and they just want to get out of their pain as quickly as possible. So if the surgery gets the lady out of pain, beautiful lady, I'll be very happy for her. But as they continue with the Invisalign, they're going to continue to make changes on the skull plates, which are then going to have secondary effects on how the fluids flow in the brain. And she could end up with other symptoms. What other symptoms would be affected? What secondary effects? All of that affects the pituitary gland, which sits right behind the bridge of your nose where your glasses are, even with temples. The pituitary controls your thyroid, your kidneys, your adrenals, your ovaries, in the men, the testicles. All of that's controlled by your pituitary. So
we need to look after that then.
That's going to make midlife crisis and menopause symptoms a lot worse. And nobody's going to tell her that that's related to having her teeth straightened. No problem with straightening the teeth, using the braces or the Invisalign, as long as you keep the skull unlocked while they're going through that. Otherwise, I've seen it cause seizures in patients. Migraine,
that's not a good thing either.
Yeah, but the dentist is going to say, "Oh, that's not related, totally unrelated," because he doesn't know what he doesn't know.
Yeah, well, and that's true. This is why I like to interview people with different skills, because you know, you don't know what you don't know, and if we can enlighten people to find natural, more sustainable way than surgery or pharmaceutical drugs that cause all sorts of other issues. We've got to do it.
Yeah, everything that I do is natural. The last aspirin that I took was back in 1967.
That's a long time ago. I was only a little girl then.
Yeah, the last the last antibiotic that I took was in 1980.
Okay.
And so people ask me, they say, well, how do you not get sick? You don't get sick. You need antibiotics if you get sick. And
Not
I tell them,
necessarily.
well, that's correct. If you know what works naturally, it actually works much better. And so I have three things that I use that act as natural antibiotics that only kill out the bad bacteria and viruses and do not kill out the good.
And how you get on, let us in on the secret as to what those three things are?
Sure. One of the things that I use is called etomidine. Okay, it's a water-soluble iodine. And I use that since 1980, somewhere around 1980. And I use the etomidine, and it's a water-soluble iodine, so it does not build up in the body, okay, like regular iodine, which gets absorbed into the fat cells of the body.
Okay.
So, and I just add 5 drops, not 5 dropperfuls, but 5 drops to a glass of water or a glass of orange juice or anything that you want. And I do that 2 times a day. If I'm around people who are sick, okay, so 5 drops twice a day for maybe 3-4 days. If I'm around people who are sick and I don't want to be sick. The second thing that I replaced it with is oil of oregano from essential oils. Okay. Yeah. And what I'll do with the oil of oregano is I'll take what we call a vaporizer that you put water in for babies. Yeah. And like we call it a Vicks vaporizer. So you put water in there, a pinch of salt to make it heat up faster. And you put in about 25 drops of the oil of oregano, and you put the heating element in, put it in your bedroom, close the doors, and in 10 minutes, it's putting the oil, it's diffusing it into the air. And in 10
would that go in our diffuser that we have?
Sure. But you'd probably use it not in water, you just use the oil of oregano, and you could put it into any kind of oil. You could put it into olive oil or coconut oil, and you could just mix it up and diffuse that in that diffuser.
Yeah. Oh, because we have a longevity diffuser.
Yep. And I don't have a longevity diffuser. I have one from another company I was in before longevity, but it should work just fine. Okay. But you could put it in a water soluble one or an oil soluble one, put it in the room, close the doors so you're not doing the whole house. Your bedroom will smell like an Italian pizzeria, but because of the oil of oregano. But what will happen is it'll kill out all the bacteria and viruses in the air. Now you're breathing that into your lungs. Yeah. So you're getting the good oil of oregano into the lungs, doesn't burn or anything. It's just killing out any of the bad bacteria or bad viruses. Okay. And I also use the oil of oregano, and I'll take a glass of water, put in 1 drop. Now I put 25 or 30 drops into the diffuser, but 1 drop, maybe 2, into the water, and I'll take a little whisk and I'll mix it up really good so the oil mixes with the water, and then I drink it. So if you were here as a patient, I'd make a glass for you, a glass for me. I'd make 1 drop in each glass of water. We would drink it. And the reason I do it with you is, number one, it's good. It's going to help you. But number two, so you don't think I'm trying to kill you, because the oil of oregano is quite hot. So when you drink it, the first thing that'll happen, you drink it and you don't even taste it. But then you lick your lips and your lips will feel like you bit into a hot pepper
Okay.
for about 5 minutes. It goes away. But I'm showing the people that, look, I'm doing it too. And they're like, oh, my lips are burning. I'm like, yeah, I told you that. It'll last 5 minutes and it'll disappear. And they're like, you're not jumping around and acting crazy. I'm like, nah, here, have another glass of water. So that goes to the inside to get absorbed from the stomach into the bloodstream to then kill out all bacteria and viruses in the bloodstream. That's number two. Number three is there is a product that the stomach naturally makes. The stomach naturally makes it from salt water and calcium. And the stomach naturally makes it, okay? As we get older, then our stomach does not make as much of this chemical, okay? So you can take this chemical and it's called, there's 2 ways you can get it. You can get it pre-mixed, or I get the one where I mix it myself, the activated, okay? So it's called MMS, Miracle Mineral Supplement. And you could look that up, MMS, not MSM. MSM is for joints, but MMS is for that chemical, and it's a special type of calcium chlorite, not calcium chloride. Sodium NaCl is table salt, sodium chloride. And this is actually my mistake, sodium chlorite. Okay.
Yeah.
So it's a slight difference. And when you take that and you activate it with lime juice, citric acid, it changes the pH of the sodium chlorite, and it creates a chemical reaction that will form what's called calcium hypochlorite. Okay, calcium hypochlorite. It smells almost like what you would put in a swimming pool.
Okay.
Like chlorine. Okay.
Like a chlorine.
Yeah, it has a slight smell like that. Okay. But we use it it's called pool shock. We use pool shock in the swimming pool to shock the pool to kill out bacteria. Well, you can do that on a very small scale, not like you would for a swimming pool, but like what you would do saying, I want to make 1 drop. And then after you let it sit for 1 minute, then you pour a glass of water into it to mix it up. Doesn't matter if it's half a glass of water or a whole glass of water. And then you just drink it. Okay. And you drink it and then you're like, oh, okay, well, doesn't really have any taste, but it's very, very good for killing out the bad bacteria. So I use the etomidine to boost the thyroid. The iodine boosts the thyroid, which boosts the immune system, which tells the immune system go out and kick ass against the bad guys. And then there's the oil of oregano, which will kill the bad guys, but not the good guys. So both of those, in fact, all 3 of those things I just mentioned kill the bad guys, but not the good guys.
And that's what we want to do.
Yeah, when you take the prescription antibiotics, you're killing off the bad bacteria and the good bacteria, and then that allows candida yeast to grow.
Yeah.
Which is a fungal problem. So you're killing out the doctors who are prescribing the prescription antibiotics, and many times they're overprescribing that for an infection that's not a bacterial infection. It's a viral infection. Well, antibiotics do not work against viruses.
No.
They only work against bacteria. So the antibiotics work to kill out the bad bacteria, but they also kill out all the good bacteria, which then allows the yeast to grow. So that creates a secondary effect that is an effect from overprescribed antibiotics.
Yeah.
Then we get the MRSA, which is what people get when they go to the hospital, and the people get an infection because those bad bacteria are now immune to the antibiotics.
Yeah.
So I haven't taken any antibiotics since 1980. So there's what, 43 years, right? But you got to know what works.
Yeah, that's right. Yeah.
So sometimes it's just a matter of knowing somebody, knowing the right people.
Yes.
That have the knowledge up here to be able to help you.
Exactly right. That's the aim of the game at the end of the day, isn't it?
At the end of the day, it all comes back to relationships. Like you and I met. What's the chances of us meeting when you're in Australia, New South Wales, and I'm over here in Texas? Very remote until Zoom came along. And now I see your smiling face on Zoom calls, and you see me, and you see Fred talking about me and talking about you, and we get to know each other through a Zoom call going halfway around the world.
Yeah, with lots of other people as well.
Oh, there's hundreds of people on our calls.
Yeah, exactly
and
right.
This is what building the relationships are about, because it's all about who you know and what they know.
Yeah, that's right. Because no one has to know everything, and no one can possibly know everything. That's just because we aren't God, right?
That's right.
But it's a case of, well, and Einstein said it very well. Why should I remember something? All I need all I need to remember is who or where to find it. So who knows it or where that I can find it. Because he didn't even remember his own phone number. He said, why do I need to remember it? I know where to find out what the number is when I need it.
Yeah.
So there you go.
Well, I have thoroughly enjoyed this time that we spent together.
Oh, me as well. And I thank you so much for coming and sharing with us today, Jim. And I better let you go. I really should, because I know you have heaps to do. And but thank you for coming and dropping by into Bronnie's world.
Well, you're very, very welcome. And now you know a little bit more about me. I hope I didn't give you TMI, too much information.
Never, not to me. Anyway, so well, to my viewers, I ask you all really nicely to stay safe, stay informed, be empowered, but do not live in fear. And if you want to know more to empower yourself about what Dr. Jim McCarty does, reach out. We're happy to chat with you about what he does, what I do, what we both do together, and how we can help you in a natural way. And thank you, everyone, for dropping by. Thank you, Dr. Jim, for coming and sharing all your knowledge with us today. And we'll catch everyone again tomorrow here in Bronnie's World. Thank you, Dr. Jim. Love you. God bless.
God bless you.